Is there a limit now to the amount of radiation an area of your body can safely receive? I mean, is there like a dose that you say, okay, this is it?
Yeah, no, that's a great question, and it comes up a lot. So the answer to that is yes. So keeping in mind that radiation therapy is a focused delivery of radiation to a particular part of the body, each part of the body has a particular limit or a safe sort of threshold that we would allow.
Threshold, yeah.
To give over time. So it's a common question as to, I've received radiation before to a particular area, can I receive more radiation to either the same or a different area? And so the answers to those two questions are very different. So radiation to a separate area, if there was no overlap with the previous treatment area, should be absolutely fine. But treating the same area twice becomes much more difficult. It is something that we do not routinely offer to patients, but can be done in select circumstances, especially with more advanced technology like proton therapy, which we will talk about later.
So if someone has received the maximum amount, the next step would be the proton therapy, which is what we're going to talk about?
Right. So if someone's received previous radiation treatment, if we need to retreat the same area, it may be possible with protons. However, it's not a guarantee.
All right. I have a question, and I'm not sure. I'm going to ask this as succinctly as I can. Let's say you have two patients, patient A and patient B, and you're doing the radiation therapy on both. Can one body react differently than the other, where it's working more efficiently in one as opposed to the other, and do we know why?
Absolutely. So we know that there's a spectrum of responses to treatment. So if patient A and patient B both receive the same dose to the same type of tumor, there could be very different outcomes. So one could have a complete response and the tumor could be gone, or there could be a very different response. We don't know exactly which patients up front will have a better reaction than others, and that's part of the next generation and the state of the art in determining and really personalizing radiation therapy and giving the dose needed for that particular patient's tumor from on a genetic and molecular level.